how many days is this that you've been sick?
5 days.
You look great. I've got to say, you look great. And, you've been charting the course of your illness on Twitter for people. So can you just take us through it? Day 1, what were your symptoms? Day 2, what were your symptoms? Day 3, and so on.
Sure. The first day I started with some chills, with sore throat, cough, and a terrible headache. Then and low-grade fever. And then moved to day 2. The headache started to fade away. I started with small mild diarrhea, and the low-grade fever disappeared also. The cough still was there. And day 3, I started to feel a little bit better.
As you were talking, we put up an ultrasound. You have an ultrasounds every day of your lungs. And if we could just put those up again, it's hard for us to know what we're seeing, of course, but what do you see happening in your lungs through day 4?
What I see my ultrasound is opacities, which is correlates with a pneumonia. So the translation to my ultrasound will be pneumonia.
So you had pneumonia. You developed pneumonia because of this.
Yes. The pneumonia is common in this disease, and right now I'm doing just fine.
That's amazing, doctor, and we're so happy to hear that. You are, as we say, a doctor at University Hospital in Madrid, Spain. Doctors, of course, are hyper cautious. I mean, you all wear gloves, you wash your hands all the time, you wear protective garments. And so do you know exactly how you caught coronavirus, or is it just community spread at your hospital?
One of my colleagues was positive probably way before the rest of us. So this is a message I want to send to all my doctor fellows, colleagues, to be careful. Anyone who is symptomatic should avoid any contact or even work.
That's interesting. So in other words, before you all started wearing all of the protective garments, one of your colleagues was positive and probably spread it through touch, through coughing, through a surface?
Yes. Back then, nobody knew that was positive. But after my positive test, he got it done as well and turned to be it. And since he was the first with symptoms, we guess he could be the source.
Doc, when are you going to be able to go back to work?
Probably in 1 week time. Hopefully, if everything goes right, I can, as soon as I don't have symptoms, I can repeat my test, and if it turns negative, I can go back to work. And probably my bosses will put me in the front line to see all patients.
Well, Dr. Yale Tung Chen, everyone appreciates being able to watch what you went through and then watch your quick recovery. Thank you so much for sharing your personal story with us today.
All week long, we've been getting all sorts of questions about the coronavirus. They keep coming in. They're different questions from last week and different from the week before. So we wanted to try and answer as many of them as possible. So the first question, when it comes to taking precautions against COVID-19 or the novel coronavirus in the office, what can employees do? I think the basics definitely apply, obviously. If you are sick, don't come to work. I mean, that's true with or without a coronavirus infection spreading. If you see somebody sick, obviously don't be near that person. And when I say don't be near that person, the distance that those respiratory droplets will typically be around is, they say, around 6 feet, 3 to 6 feet. So that's a safe sort of distance in terms of a social distance within an office space, within any kind of space, really. And by the way, that's why a lot of these big mass gatherings are increasingly getting canceled, because it's hard to find the social distance if people are sitting right next to each other or standing right next to each other. So keep the distance, stay home if you're sick, clean surfaces, as much as possible. You know, be that crazy person with the wipes for a while. I have been that crazy person for a long time. I think it can really be of benefit. What are some of the common ways people spread germs and viruses in the offices? Same thing. They spread it typically through these respiratory droplets and then by touch. Touching things, moving your hand, touching something else, moving the virus from one place to another place, and then someone touches it and they get infected. So try not to touch things. I think it's hard. And when I say touch things, I mean touch objects, touch surfaces, touching your face. Try not to do that as much as possible. What would you do? What would you recommend to keep our mental health in check as we increase social distancing and working remotely? It's a great question, and I'm thinking about it a lot personally with my own family, my own friends. First of all, social distancing does not need to mean social isolation. Okay, I think there's many ways that we can still stay connected, and maybe we can even stay more connected than we typically do. One thing about this virus is I've been reporting on it for so long now and talked to so many people here in the United States and in other places around the world, is that there's this realization, I think, that we're all in this together. This is a pathogen that affects everyone and doesn't discriminate against anyone. We're all in this together, and we are in a position now where our individual behaviors have such an impact on the people around us. Your health is so dependent on how I behave, and my health is so dependent on how you behave. So if you are practicing good hygiene and making sure you're not a source of spread, you're doing it not just for yourself, you're doing it for all the people around you as well. And I think there's something that's in a way, it brings us together in a way that I have not seen before. And I think that hopefully maybe that relieves a little bit of anxiety and brings us together.